I thought I needed an MD degree to do the things I really wanted to do. So I knew healthcare system was flawed. I knew that we needed substantial change. I'd always had an interest in policy, but I thought that I needed an MD degree for people to really take me seriously and wanting to make those changes. And so that was part of the impetus, part of my interest in wanting to go to medical school. But I started to realize through my other work experiences post undergrad that there were other opportunities. And that's actually how I started to learn more about public health. I was a research assistant, like a clinical research coordinator as well at Johns Hopkins, the schools of medicine. I got to work at the School of Public Health a bit on some of their projects as well. And it was there in my exposure to some of the trainees. I worked with like fellows and residents and medical trainees. It was there that I really started to better understand, like, oh, there's public health. Like that wasn't something that was really on my radar.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 70. Hi everyone, Omari Richards here. Thank you all so much for joining me once again for another great public health story today. Before anything, make sure that you subscribe, that you like this, that you share it with a friend, that you leave a review. If you want to support, you can go to buymeacoffee.com/the PH Millennial. You can go to Instagram and follow me at the PH Millennial. Greatly appreciate that. And definitely share with a friend who you think this might be valuable with. But anyway, and really enjoyed this conversation today with a real health equity leader in the space. I really loved her story and the great insights she shared, as well as like her story coming full circle towards the end. So be sure that you listen to the entire thing, but I hope you listen to all the episodes because there's just some great gems that are scattered about in there. But enjoy the conversation and you all will see me next week. Enjoy. Today we have someone who helps systems and leaders move from health equity in theory to health equity in action, by noticing and intervening on how racism and other oppressive forces operate within themselves and their systems. She's a 2020 Fortune 40 under 40 in healthcare. She's got her Bachelors of Science in Biochemistry at Xavier University of Louisiana, then her PhD in Clinical and Population Health Research at the University of Massachusetts Medical School, and also got a Master of Public Administration in Management, Leadership, and Decision Sciences certificate at the Harvard Kennedy School. She currently works as the Vice President of U.S. Health Equity and Community Wellness at Takeda Pharmaceuticals, as well as being the President and CEO of the Equitist. We have Dr. Lauren R. Powell, MPA, PhD. Welcome to the show.
Oh, thank you so much. Thanks for having me. It's a pleasure to be here.
Yes, I'm really glad to connect and to get you on to share your story today. So I guess we can jump in. How are you and how have you been doing throughout the pandemic?
I'm well. I'm very grateful to be well, healthy and well. I am busy, busier than I think I have ever been, but busy doing necessary work. So as you can imagine, health equity is front and center right now. This is what I have trained for. These moments like these are what I have trained for. And so I'm very busy, but happy to be of service right now.
Yeah, well, I'm glad that you're getting to do the work that is important, and it must be very draining. But we need people like you to continue to stay in these spaces and do the work, and because we need change, and we needed it like last year. So I appreciate it. So how do you identify, and then tell us a little bit about your personal background?
Yeah. So I identify as a Black woman. I identify as I don't know. I'm a sister. I'm a daughter. I am a leader, I guess. That's a really interesting question, how I identify. But yeah, that's how I identify as a Black woman, as a straight Black woman. I guess that's an important thing to note as well. And a champion for health equity, a racial equity leader as well.
Okay. And then share a little bit about your personal background. Where you from? Where do you grow up? All this
Yeah.
stuff.
Oh, yeah. So I am from Indianapolis, Indiana. Yes, for the record, there are Black people there, lots of them. I grew up in the Midwest and born and raised there, still have lots of family in Indianapolis, Indiana. I went to undergrad at Xavier University of Louisiana. So I moved to New Orleans, was there for 4 years, and really just love New Orleans with all of my heart. Love my HBCU as well. I have a sister and we're very, very close. We're only like 16 months apart. She's a journalist. And so we just had like so much to talk about across the headlines for this past year in particular. I mean, we've always had a lot to talk about, but even more so now. Um, and yeah, I guess that's basically it. I have friends all over the country, all over the world. And what else? I like wine. I like shopping. I really, really miss live music events and concerts. I really, really miss that a lot. And I like to work out. Yeah.
Okay. Well, what kind of wine do you prefer, and where is the nicest place you've gone to a winery?
So I prefer red wine because I think if you don't drink red wine, then you're not a real wine enthusiast. There are actually some really great vineyards in Virginia, like over 100 or something like that the last time I checked. And so I've been to a couple just kind of off the beaten path in Virginia that have been really, really nice. I don't remember the name. I went to one last summer. I can't remember the name of it, but it was really cute. It was kind of in closer to Northern Virginia. But you also kind of have to be careful because some of the vineyards here are on former plantations. And, you know, depending on how you feel about that, I don't particularly want to go celebrate on land and establishments like that. But there are some really great vineyards and wineries here.
Okay, awesome. Well, thank you for sharing that. And before we get into your story, what does public health mean to you?
Yeah. Um, to me, public health is, I think it's an art and a science, quite frankly, of really working to ensure that everyone has the ability to um, reach their highest potential and level of health and wellness. And in that definition, to me, is health equity as well, which is to me intrinsically connected to public health. And ultimately, public health is about making sure that the public is healthy. And so to me, if you don't like working with people, if you don't like working with the public, then maybe you shouldn't be in public health.
Yeah, absolutely. And I'm glad that you tied health equity into it, because I think that it has been a buzzword here and there now, but it has been a part of public health, and it has more so been pushed into a lot of the work and the frameworks that have been going on, but still needs a lot more work. So I'm glad that you mentioned that as well. So as we mentioned earlier, you got your Bachelors of Science in Biochemistry. You also got a double minor in Math and Biology at Xavier University of Louisiana. So tell me about the thought process from moving from Indiana to Louisiana to go to school.
Yeah, well, to my mother's dismay and to my parents' dismay, I knew very early on that. So actually, both my parents went to an HBCU. They went to Kentucky State University, and I knew very early on when college was required. My mom and all of her sisters. So I have four aunts. They all went to college and graduated from college. Which to this day, I still like cannot figure out how my grandparents did that. They were a rare. That was a rare thing for Black families, especially during that period of time. On the other hand, my father is the only one out of his brothers and sisters to graduate from college. So I knew that, you know, higher education was a requirement for me, was a requirement for us, and actually something my sister and I were really excited about and looked forward to. But, you know, and I loved HBCUs. We have something in Indianapolis called the Circle City Classic, and that brings two HBCUs to Indianapolis to have a battle of the bands, and they had a big football game, and it was like a homecoming. It was like an HBCU homecoming in Indiana, which doesn't have any HBCUs. So I knew from those experiences that I wanted to go to an HBCU. I was really interested in science and really interested in medicine. And so I wanted to go to Xavier because it was number one for placing African Americans into medical school, and I really, really wanted to go to medical school. So that's what drew me to Xavier. I had driven by the campus probably when I was like, I don't know, 11 or 12 years old or something. We went to on a family trip essentially and drove through New Orleans, and that was the only exposure I had to it, but I knew that's where I wanted to go. So that's the only school I applied to, and thank goodness I got in. And that's where I ended up going. So I was there for 4 years, 3 of which were very adventurous and just exceptionally has so much fun, but also just learned a lot. And my senior year was much different. My senior year was much, much harder because Hurricane Katrina hit my senior year. And that really became less of your average college senior year experience of just like nothing but memories and fun, and became more honestly survival of the fittest. It was a very, very difficult time. It was hard, not only for the city of New Orleans, but for the students who made New Orleans their home. It's a big college town, lots of major schools in the area, so a couple of HBCUs, Xavier and Dillard. And it was a tough time.
Okay, wow. And yeah, I didn't even think about the effect that it would have on students. But yeah, tell me a little bit about that. How did you deal with that? What did happen during that time being a student?
Yeah, it was really hard. So we had 1 full week of our semester of classes. So I had 1 full week of my senior year, and I just remember, we were so excited to be seniors. We went out like Friday night, and everybody was, just hyped to be out. And we'd been seeing hurricane coverage the whole week. So earlier in the week, it was projected the hurricane would go to Florida. You kind of move on with life. And by the way, these kind of hurricane warnings and scares come all the time. And like, as much as there are thunderstorm warnings, they come all the time. So, people were like, okay, it's probably going to be a tropical storm or something. Went on about our lives for the week. And then I just remember Friday hearing something a little bit more about, oh, it might come towards New Orleans, and, didn't really think much about it. This is the first week of senior year. Of course, we go out on Friday night and party, have a good time. And it's really, really late. I was taking my friends home, and I got home and I couldn't really go to sleep. So I remembered I needed to have my oil change. I've been meaning to do that like the whole summer, which is so random. Like, why? Who just does that? What college student is like, I think I'm going to get up and go get my oil change, but I did. So I was like, let me just go ahead and go to Walmart, because Walmart's the only place to go. And I got up and I was like, let me get here early because I don't want to be here all day. So got there. It was like literally 6 a.m. and dropped my car off. I go inside and it's like pandemonium. Like people running around everywhere, like water, grabbing generators. I was like, I'm sorry, is this supermarket sweepstakes? Like, what's happening here? They're like, there's a Category 5 hurricane coming straight for New Orleans. I was like, no, there's not. It's going to Florida. Lo and behold, I turn around, the TV is on. It's literally coming straight towards us. So I told, called my friends who just gone to sleep like hours before. I was like, so we kind of need to talk about this. I think there's a hurricane coming. Maybe we should just go to Texas, because everybody had like a hurricane friend, family, refuge. Everybody in Louisiana had people in Texas, Houston for the most part, they could go stay with. So I had a family friend who was so gracious and allowed us to come there. So we drove there on Saturday morning at this point. And, I packed a bag of club clothes because I was like, oh, we're going to Houston for the weekend, we'll be back. I brought a couple of books and, my computer, and that's it. Same with my other friends, and, folks left their cars parked on campus, like, oh, I should probably leave my car on campus. It'll be safer. Campus actually flooded out their cars. And we drove to Texas. What usually takes, I want to say that the drive to Texas is usually like 5 hours or so, 5.5 or something. Took us 10 hours because people had started leaving. Now there was no mandatory evacuation at this point. This was just people deciding for their own safety's sake to go. And We started our drive to Houston. Now, remember, this was 2005. So, dang, that sounds so long ago, but wow, it was 2005. And technology has changed so much since then. So we didn't even have like Google Maps. We didn't have, we had like TomToms and Garmin's, which if you don't know what that is, that's basically Google Maps and like a separate device. So if you didn't have that, you really didn't know where you were going. So we were on the phone with people trying to figure out how we go through the bayou and, cut past all the traffic on I-10. Anyway, it took us basically twice as much time to get to Houston. We got there basically 10 hours later. Stayed at our family friend's house, so gracious. We stayed there for basically like 2 weeks because first we got there, then the hurricane hit, then the levees broke, and then we were like, okay, I guess we should go home. So that was just leading up to, the hurricane actually hitting. We all dispersed and many people went back home. Some people enrolled in schools and, had different academic experiences in places. And I tried that. It didn't really work out where I was. I went back to Indiana and I was so far along, especially as seniors. It's really hard when you're so far along that, you can't just jump into some introductory courses somewhere. So I actually had the opportunity to intern with the Washington Center for Internships in DC. So I went to DC for the rest of the fall semester, worked as an intern. I actually had the chance to work with Catholic Charities at that time, Catholic Charities in DC with their, it was really a health equity initiative. They didn't call it that. That's really what it was. And I was helping to pair doctors who would volunteer their services to help care for patients who couldn't really pay. And that was my first kind of deeper foray into health disparities and health inequities, and also dealing with the trauma of Katrina. We did go back to school. We went back January of 2006. We did 2 semesters back to back. It was really difficult, housing shortages and destruction everywhere. Still, electricity was out in half the city, and we had like one Walmart, one drive-through, not a lot of ambulances or emergency services. And because of the destruction, there's a housing shortage. So like my apartment tripled in rent, but I couldn't get rid of it because I had there was nowhere else to go. So I had 3 jobs. I had a full course load and pushed through to finish my degree. Also, cared for some of my classmates who were experiencing homelessness because they lost their apartments, and all the housing on campus was fully saturated because people were moving back on campus because that was the only housing that was really available in the city in some cases. So very hard times, but I think that experience really solidified my awakening to health disparities, to health inequities, to the social determinants of health in ways that I didn't know how to label then, that I can clearly recognize now.
Yeah, and I think that makes complete sense. Wow, that is a lot that you probably have to deal with, and kudos for you for being able to push on and get through that with all the jobs and the different positions and school and helping friends and all the emotional and traumatic things in there. So like kudos to you, and I'm glad that you made it out and at least found, I guess, a sunflower in all of it, and really decided to push on and see that health inequities and health disparities was something that needed you to do the work on. So tell me, do you have any other takeaways for undergrad besides that entire ordeal you just explained there? Because wow.
Yeah, I mean, undergrad was just so enlightening. I think from a social and cultural perspective, I was a Black girl from Indiana, so it was so beautiful to be in an HBCU and to see so many different kinds of Black people. That sounds like, what do you mean? I mean, there's Black people who love hard rock metal, right? There's Black people who love yoga, who are vegan, who, all of these different flavors of Blackness that I just feel like as Black people, sometimes we're we are not always privy to being able to see, even because of how the media portrays us as being a monolith. And so it was just so beautiful. Some of my best friends, all of my best friends, quite frankly, came from my time at Xavier. Xavier was a smaller HBCU, so we're really like family. We really keep up closely with each other. My colleagues are just so successful and so like woke and just grounded. And I took that away from my time in undergrad. And the fact that, you know, we can do anything we put our minds to. We really can. I also had the opportunity because Xavier is a Black Catholic university. We had to take the theological courses. We had to take, courses about divinity, and that was so enlightening as well. We were required to be very immersed in the community, which was also a really positive thing for me. And I just loved my time. I loved my time in undergrad, and I wouldn't trade it for anything.
Oh, I'm glad you loved it and persevered and went on. And then, so after your time in undergrad, you went on and got your PhD in clinical and population health research at the University of Massachusetts Medical School. So tell me about the thought process of going into this degree.
Yeah. So I had quite a few years of working in between actually going back to get my PhD. And I should also say in between that time, I applied to medical school too. So I was still interested in going to medical school for quite a while. I applied twice. I was rejected twice, which is not really very uncommon. But at a certain point, I just kind of felt like maybe there's something else for me to do here. And I'd originally really wanted to apply to medical school because I thought I needed an MD degree to do the things I really wanted to do. So I knew healthcare system was flawed. I knew that we needed substantial change. I'd always had an interest in policy, but I thought that I needed an MD degree for people to really take me seriously and wanting to make those changes. And so that was part of the impetus, part of my interest in wanting to go to medical school. But I started to realize through my other work experiences post undergrad that there were other opportunities. And that's actually how I started to learn more about public health. I was a research assistant, like a clinical research coordinator as well at Johns Hopkins, the schools of medicine. I got to work at the School of Public Health a bit on some of their projects as well. And it was there in my exposure to some of the trainees. I worked with like fellows and residents and medical trainees. It was there that I really started to better understand like, oh, there's public health. Like that wasn't something that was really on my radar. And they kind of let me know, public health is really where it's at. Like some of them who are highly accomplished, medical doctors at this point, they're like, if I could do it all over, I would have gotten a PhD in public health. And I was like, really? So I listened to that. I explored, I really leveraged the fact that I was working for a world-class academic institution. And I took that as a chance for me to learn too. So it was through that experience, I moved on to work at the NIH, National Cancer Institute. I was managing clinical oncology trials there. I finally stopped and realized, wait a minute, I have like, I guess, a career already. And we had a case at the NIH that really sat with me. It was a young Black male who was maybe like 16 or so, athletic, very active, was diagnosed with a very rare form of cancer. And there was a clinical trial that he was eligible for that really would have been the only form of treatment that could, have any sort of impact on this type of cancer that he's been diagnosed with. And his parents, we, were offering him a trial. His parents were like, no, like, we don't want him to be part of a trial. Like, no. And that really sat with me. We called in a bioethics consult. I was like, bioethics, what's that? So then I was like, I want to know what that is. So researched that a bit and followed up to learn more about that. And, spend some more time talking to the family, and eventually the nurses were able to get through to them, and they did consent to him being a part of a study. And I think it turned out pretty successfully, it turned out pretty well. But that whole experience, I was like, there's something doesn't sit right with me here. You know, how do you, who works on solving this problem? Like, who works on trying to ensure that we're doing a better job of including minorities in clinical research? And then I, as a clinical research coordinator, had the experience of trying to consent people, trying to explain studies to people, trying to go through informed consent with people. And I'd have my own face-to-face experiences with that. So I said, wait a minute, maybe I can actually spend some time researching that and like figuring that out, because that could be a major driver of health inequities. And that's what led me to grad school. So I, in a very interesting chain of events, reached out. I was just interested in knowing more about a couple of programs. One of them in particular got back to me and was like, oh, we really want to talk to you. And I did, and a couple of conversations and an application kind of after the deadline led to me going to grad school. So I moved from DC. I moved from DC to Central Massachusetts, which was a culture shock to say the least, to work on my PhD, and that's how I ended up going.
Okay, wow. Thank you for all of that. What in reaching out to the schools was, and then in those conversations, was it that made you decide you wanted to go to this school?
I was looking at programs about like around clinical research or population health. And a lot of those programs, even still today, I think, were very rooted in having to had already having had like some clinical experience, some clinical expertise. So a lot of those programs that were focused on clinical research or population health in some way, they were wanting clinicians. They were wanting medical doctors or nurses or physician's assistants. And so I was specifically looking for a program that would accept me as not being a clinician, but having had all of this relevant experience. That was one thing. The other thing was, you know, I really wanted to challenge myself to understand the kind of the roots of study design. So like epidemiology and biostatistics. And that was a core part of this curriculum. And I was also looking for the opportunity to expand my interest in community health, in health equity, and health disparities research. And so all those things kind of aligned. I'll also say a really big thing is that I didn't have a master's at this point. So I only had a bachelor's. I had 7 years of significant work experience, not 7, maybe 5 years maybe of significant work experience at that point. And I was looking for what could my next step be that actually didn't put me in more debt, because I already had student loans from undergrad. And I know that master's programs, especially MPH programs, are pretty hard to come across funding for. So I was drawn into this program because they actually had, it's kind of like a bridge. Is that what it's? Yeah, it's like a bridge program. So I came in, I didn't have a bachelor's. I did a 1-year kind of bridge program that exposed me to some of the master's level and like sort of PhD level courses. And then I matriculated straight into the grad program. So I actually did my PhD in 3 years technically, but yeah.
Okay, that's awesome. And tell me more about that. Most people do not complete their PhD in 3 years. Was it that because you also got like some credits from earlier on, plus just worked hard and did everything you had to do?
Yeah, I was very motivated because I knew what it felt like to get a paycheck and to be able to, you know, be independent and have a life and not have to live in Central Massachusetts for the rest of my life. So I knew what it felt like to be an adult, you know, and I wanted to gain as much experience and knowledge as I could from this period of time, but I also wanted to keep it moving. Like I've always known intrinsically I have stuff to do. Like I have things to accomplish and things to get done. So there was that, but I think also that, you know, I got some credits from being able to do the bridge program. So I really leveraged my time there, and I came in knowing what I was interested in. So this is something I actually think is really important for younger students who are trying to figure out, like, is it worth having what are they called? Like a gap year now? Is it worth having, time off between to work versus going straight through to school? There's so much value in taking time to actually be a part of the real world. One, it teaches you how to work with lots of different people, right? Like I've had to work on deadlines. I've had to talk to people who were much more senior than me. I've had to talk to people who are rude to me. I've had to work with a lot of different types of people, and that helped me so much in grad school. Two is that I've had the time to figure out the things that I like and I don't like, right? So the type of research I want to do, or the types of data that I might care about, or what I actually want to focus my dissertation on. I came into my program knowing exactly what I wanted to focus my dissertation on. It never changed. And because of that, I was able to push straight through. Do I want to do this or this? No, I've already determined what I'm interested in. So I want to do this, right? So it saved me some of the time that some students end up spinning their wheels, like, oh, I don't know what I'm interested. I knew exactly what I was interested in. And so I was open to learning about other things, but I still was laser focused on what I cared about. And that really helped me be able to push through. And the third is that I just had some really good internal mentors. I had a really great academic mentor who just really supported me and really helped me, blaze my trail and move through and do everything I wanted to do quickly.
Okay, awesome, awesome. Well, thank you for sharing that. I did not know that people could go straight into PhD programs after like the bachelor's until I started this podcast, actually. So I'm glad that you re-mentioned that so that people are aware of that. And I'm glad that you also mentioned, I feel like a lot of people do say, who at least have taken a gap year, some people who haven't, say that they find a lot of value in it just because, as you said, like you learn what you know, or what you like and what you don't like. You came in and you knew exactly what you wanted to do. And I think that is a lot of the battle in like getting a PhD, especially because there's so many different things that can pull at you. So what was your dissertation about?
Yeah. My dissertation was about ways to increase the participation of minorities in clinical research. So I actually coined a new title or a new concept, I should say, research literacy. So if we think about like, we have health literacy, financial literacy, I introduced a concept of research literacy. So what would it look like if we actually helped people become more literate and understand what research is, clinical research and clinical trials and the jargon we use around that? What would it look like if we increase their literacy and their understanding of that, like far, far prior to the point of actually asking them to be a part of a clinical research trial or a research study? And so I actually created a scale to assess that. I did primary data collection. So I went out and actually hit the streets and did the data collection myself. We had people complete surveys, and I actually did all this face to face. I did focus groups, I did key informant interviews, I created a scale from the ground up. So survey creation and qualitative data analysis, quantitative data analysis, all of that from the ground up. So it was actually really interesting and really, really rewarding. And that's what I focused my research on. And I found that while there are some positive outcomes from helping to increase research literacy amongst folks, it could also backfire in a way, right? Like the more people know, the less interested they may be. But hopefully thinking about ways to build trust, especially in our healthcare system, beyond just educating people about clinical research, could push that outcome in a different direction. And so it's so interesting at the end of my dissertation, at the end of my defense, when people ask me, what do I want to do next? How do I see myself building upon this work? I actually said to them, I want to go work in pharma and I want to help them understand how to do a better job of diversifying clinical research, clinical trials, and how to do a better job of building trust in communities of color and Black and Brown communities. And, people were like, oh, that's pretty far-fetched, it sounds really fun, really interesting, but probably won't happen. That was actually 5 years ago. That was 5 years ago. And now that's what my job is. That's what I do.
That is awesome. That is awesome. I'm glad I'm getting to capture this and getting to hear you share that part of your story. People didn't like they're not seeing your vision or seeing what you want to do, or just like trying to talk you down with that. I think that just goes to see that some people just don't have their mindsets on things big enough, or just set in this world is going to be this certain way. But I think we have to take our part and do what we have to do to get the things that we envision in this world. And you absolutely did that for yourself. So that is really, really awesome and commendable.
Thank you.
You're most welcome. And then you graduated and you became a clinical research coordinator at the Dana-Farber Cancer Institute. So tell me, how did you get this, and then what do you do in it?
Yeah, so I worked at Dana-Farber actually before I went to grad school. So all of my clinical research coordinator type experience was before I went to grad school. At Dana-Farber, I actually got to work on more like behavioral kind of studies, like social science and like behavioral studies of oncology patients. So looking at ways to help, educate some of the oncology patients on some of the behaviors that would minimize some of the side effects from some of their medications and things like that. It was very interesting. So I worked in a center for nursing. So that was great. I'm actually realizing through this conversation, I've had the exposure to like work with so many different roles within the healthcare industry. So I've worked with among a cohort of leaders in nursing. I've worked with physicians in training. I've worked with attendings, worked with actual physician scientists. So it's really interesting. I've never made that correlation until this moment. So, but in that role, I got to work with a lot of nurses, and it was really eye-opening to see the ways that they kind of approach care, which I think is different than how medical doctors approach care.
And then you also were a Boston Albert Schweitzer Fellow for Life. So tell me about that. I'm sorry if I also butchered that name.
No, that's right, Albert Schweitzer. When I was in grad school, I pursued a lot of things that were off the beaten path, quite frankly, for a lot of people in my program. So my program was very quantitative based. It was literally in the Department of Quantitative Health Sciences. And while I appreciate an understanding of data and understanding of numbers and how important data is, that was never what really did it for me. I've always been more interested in like community and how to be a part of the community, how to work with the community. And I came across an opportunity, the Albert Schweitzer Fellowship, and it's basically a fellowship that built upon the legacy of Albert Schweitzer, who was very much committed to health equity, very much committed to working in underserved communities and bringing health and wellness to those communities. It's a one-year fellowship in which we had a cohort of multidisciplinary scholars. So I had colleagues who were in dental school, who were in social, studying social work, and who were in all these different facets and corners of throughout Boston, the Boston, metro area, but all working on health and wellness and like sort of health equity in some way. And we were part of the same cohort, but we had a challenge and we had to create our own sort of project during our time there and pursue our own project. And I worked on a project with a local organization in central Massachusetts, in Worcester, Massachusetts, which is where UMass was, on bringing health screening interventions to Black and Brown barbershops. And so that's what I worked on as a part of my project. And it was a year-long fellowship. And once you finish the fellowship, you become a fellow for life. And so that's what that designation is. And I'm still in touch with some of my fellows today.
Yeah, it's awesome. I'm glad that you got those connections in all the different places. And it sounds like it's a very worthwhile experience in a lot of different ways.
Yeah.
And then I see here that you were visiting research fellow. I'm guessing this was during your time in your PhD program as well?
Yes.
Okay, yes. So visiting research fellow for the Office of Health Disparities and Research at the Mayo Clinic. So you're going to talk a little bit about what that means to be a visiting research fellow and then what you did?
Sure. So I spent about a month out in Arizona at the Mayo Clinic site in Scottsdale, Arizona, and had the true honor and pleasure of serving as a fellow there. And what that just means is, I had a very finite period of time working there on a specific project that I had the opportunity to partner with Mayo Clinic on. And it was actually an extension of my dissertation work. So at the time, I think I was starting to write I think I was writing already. So I'd already collected all my data. And what I actually did while there was pilot. So remember, I said I was working on research literacy. I collected some data to see what people actually understood about clinical research. So like, do you know what a placebo is? Do you know that you have the opportunity to change your mind after signing a consent form? Do you know, those types of questions? Do you know what randomization means? What I then had the chance to do while I was at Mayo was pilot some workshops basically on helping to educate people in the community about what clinical research actually is. So I worked with a couple of local Black churches there, held one or two kind of just workshops and kind of introduced what could be the intervention to help increase research literacy. So it was really, really great, really cool. And actually, interestingly enough, was kind of the foundation of what I'm starting to build upon more now in my position at Takeda. So.
Okay, well, that kind of speaks to you telling the people at your dissertation defense, that's the kind of work that you want to do, and you got the opportunity to do a little bit of it here. So what did you go from your PhD into your Master's of Public Administration?
I did. Little known fact, I went backwards. So I went from a bachelor, I went totally out of order. I went from a bachelor's to a PhD and then backwards to a master's. Okay, I'll explain how and why. So when I was writing my dissertation and I started researching, opportunities. I started researching career opportunities. Like, where could I go with this degree that I have now? And it was interesting. I talked to a lot of different people. I had some informational interviews and it was interesting, but I was not really impressed with anything that was out here. Mind you, my degree was very new. So people didn't really, and people still don't quite know how to interpret it. They didn't know like, well, what does that mean that you can do? We're not sure how that would translate into, the private sector, this, that, and the other. So I was like, yeah, I don't think I'm really done yet. I think I've had this lingering interest in policy, interest in health policy. And I recognized and realized throughout all of my time matriculating for my PhD, really didn't get any exposure to policy the way that I feel like is really, really necessary to make a significant impact on health and population health and health inequities here. Because our healthcare system is run on policy, right? From the ACA to insurance policies to all of that, it's all run on policy. So if I don't understand policy, I'm not sure that I can be as effective of a leader in this area as I want to be. And so I was looking for ways. I was like, maybe I could do a fellowship or something that would give me some exposure, looking for some opportunities. I have talked to some colleagues and someone said to me, you should really apply for this position or this program actually at Harvard. And I was like, oh, okay, maybe. Like, and they were like, no, it's a mid-career program, which means you have to have had like, so many years of work experience. It's only one academic year. I think you'd be really good for it. I was like, okay, I guess I'll apply. So now I have done this a couple of times in my career at this point. I do not advise it, but it was the only thing I applied for. I didn't apply for any postdocs. I didn't apply for any jobs. I didn't apply to any other schools. That was the only program I applied to, the only thing. Even my academic advisor was like, are you sure? Like, you don't want to back up or something? I was like, no, if it doesn't work out, it just, I'll figure something out. Thank God I got in. And then I was extremely blessed to get a scholarship. So that solidified it. And I went to go work on my master's. So I literally graduated with my PhD in June and I started school again in July. And my family was like, okay, so this really has to be it. Like you can't go any higher than this. Like it's going to be over after this. I was like, yeah, okay. It's going to be over after this. So yeah, so I did the master's. It's called a mid-career and master's in public administration. so MCMPA program at Harvard is what I did. And it was the best academic decision I have ever made in my life. Transformative year. Amazing how many classmates and friends I have all over the world as a result of just 9 months. This was a 9-month program. It was an academic year, and it was truly exceptional.
Okay. And what were some of the things that made it so transformative for yourself?
I think Harvard is a very special place, a place that still has its own problems, right? Like deep-seated and rooted in privilege, and still rooted in racism. And they have some ways to go in, really eradicating racism from as an institution of higher learning. But the people that I met there are just really amazing, really committed to change, really passionate about their area of change, really good people, just like fun, down to earth people. I was also there, I should say, this was like a transformative year as well. I was there for the 2016 election, which was a very, very interesting time to be anywhere near government and politics, but especially to be in arguably the world's #1 school of government and policy. So I had the opportunity to hear from leaders I would have never heard from. Angela Davis literally sat next to me in like a round table, and I got to ask her a question. I'm like, what? How is this possible? So it was just, the Harvard experience is just so different. Then I had the opportunity to be a Sheila C. Johnson Fellow in the Center for Public Leadership, which was just added sort of cherry on top. And Sheila C. Johnson was our benefactor, and an amazingly accomplished Black woman working in the hospitality industry, which is very white. But she gave us the gift of community. And so I had, other fellows who were equally invested in the Black community, equally invested in equity, and just equally motivated. So it was all around a really great experience. I had some great professors and just people who really challenged my thinking and pushed me in learning.
Okay, and all of that in 9 months. So
I know, it's insane. All of that in 9 months. I can't believe it.
Yeah, that truly is amazing. And I've had a couple of friends do a couple like Harvard programs, like 1 year or like summer classes, and they have enjoyed it a lot as well. So it just keeps on speaking to Harvard for some reason. So we'll see what happens across there. And then you also Harvard Square to Oval Office Women and Public Policy program, or you were in that program. So do you speak about that?
Yes, that was a really fun part of my experience. So when you're at Harvard, it's not just being kind of like there. It's like as if that isn't enough. That's more than enough. But then there's other things you can be a part of while you're there. And one of those things was Harvard Square to the Oval Office. And there are lots of opportunities. I also took a class called like the making of a politician, which I'm not announcing anything. I don't know if I will ever run for office, but at that time I was very interested. And Harvard Square to the Oval Office is really about really helping to nurture and prepare women for roles in leadership in government. And what I loved about that is that it was not just restricted to the United States. It was preparing women for government leadership positions all over the world. And some of the alums from that program have gone on to run their countries, to be ambassadors, to be, major legislators and major voices of activism and change in their countries. So it was really, really cool.
Yeah, that is awesome. And I'm glad that you got to connect and learn all those different things. And then did you also get so you got the MPA in management and leadership, and then did you get a decision sciences certificate, or how does that work out?
Yeah, so there's the degree is a master in public administration, but then if you take there are certain courses you can take that can lead to an additional certificate in leadership and management and decision sciences. And so I took like negotiation and some other courses that are really about like strategy and decision making that permits you to get this extra kind of certificate. And so I did pursue some of those courses. One of them I think was about kind of diversity in leadership and management. And really, I mean, the Kennedy School is very much about leadership. I mean, I took so many courses on leadership. Actually, one of my favorite ones that I think contributed to this certificate was a course by Barbara Kellerman that was about leadership and followership. And in that course, we actually examined leadership not from the perspective of the leaders that we loved, but people who were leaders that we didn't really like, right? So like Hitler, for example, right? Like very divisive and like evil leaders, but who still had a following, and like learning from the perspective of followership, what makes a leader worth following. And then also like looking at the attributes even through the lens of people who we don't like or don't agree with, or we felt like was very divisive. We could even put Trump into that. I actually wrote a paper about him in that class. That's scary how true it ended up being. But, you know, looking at the qualities that made them a leader and how we can actually learn from that. It was so interesting. And I think about it so very often because, you know, we prop up leaders who do great things, but some of the qualities that made them so powerful also bleed over into those leaders who have been very evil and divisive as well.
Yeah, and that makes sense. And I guess along this leadership vein, do you want to give 2 or 3 leadership tips that you have learned throughout your career?
Sure. I think I'm still learning leadership tips, quite frankly. Let's see. I think one of the first that I've learned is authenticity goes a long way, right? So don't feel like you have to be like a certain leader that you have grown to love, or like don't feel like you have to be some sort of way, right? Be yourself. Be yourself. And I have learned that, and I really appreciate that. 2, I would say tell the truth, right? Your integrity, your reputation, um, that precedes you. So tell the truth and be honest with your teams, be honest with your colleagues about when you don't know the answer to something, when you're not sure of which direction to go. Be honest about that and tell the truth. I think the third maybe is commit to being the best at your craft. So whatever it is that you are drawn to, whatever it is that you love, like commit to doing your very best to be the best at it. And that doesn't mean that you're going to know everything that there is to know about it, but be eager and open to continuous learning and working to be the best you can.
Absolutely, absolutely. Thank you for that. And I think like leadership is a continuing learning process. Like
Absolutely.
I think if you ever find a true leader, they're always going to tell you that they're still learning their leadership skills and you know changing it as time sees fit and the people that they're working with as well.
Very, very much so. I feel like I learn something new about leadership, honestly, every week. Every week, there's something new that I'm like, oh wow, that's a lesson for me. That's something for me to think about. Yeah.
Yeah, it's awesome. So then after graduating with your MPA and your decision sciences certificate from Harvard, you became a health equity strategist consultant at the Cambridge Health Alliance. So what was the thought process for getting this position?
Yeah, so that was actually a little known fact. I have the Equitist now, which is, you know, my company now, but I actually dabbled in consulting while I was a student. So let me just say, I've always been hustling, right? I've always had multiple jobs. I've always had multiple things going on. So while I was a student at Harvard, I was actually working with the Cambridge Health Alliance, a mentor who I met through the Albert Schweitzer Fellowship, actually recognized a lot of my passion for health equity, a lot of my passion for cultural humility, which was really needed as a foundation of health equity, asked me to come and work and help shape some workshops and learning opportunities for his staff. And I was like, what? Like, seriously? I mean, I've done a couple of PowerPoints here and there, but like, I don't know if I'm ready to do a workshop. He challenged me, gave me the opportunity, and that really helped set the foundation for what would eventually become the Equitist. I didn't know that I was going to call it the Equitist. I didn't know when it would happen, but that was really the beginning. And I'm very grateful to that mentor. And so I started off really kind of introducing health equity to his staff, and we did some workshops together, and we did some learning opportunities together, and really challenged them on racism, and challenged them on several other forms of oppression. And it was very eye-opening for me, and a really, really great learning opportunity for me. And I still to this day keep in touch with that mentor, and it really, yeah, it really set the path for where I would go in the future.
Yeah, that's awesome. I'm glad that you were able to get this experience and you were able to hustle and get it, and have the mentor to pull you in to do the kind of work that you might have maybe felt uncomfortable doing if he had not, or she had not pulled you into it.
Yeah.
So thank you for sharing that. And then after this position, you became the director at the Office of Health Equity at Virginia Department of Health. So how did you get into this role?
So I graduated from Harvard, and I was looking for positions. I was like, okay, I'm done with school. Like, I'm looking for a job now. I actually applied in a lot of different sectors, applied to the private sector. So some major global consulting firms, applied for some other state government positions, and just was really exploring my options. And uh, I came to realize like consulting firms wasn't really what I was looking for. I really wanted to make a direct impact. I wanted to be in a position of leadership. And so that was really wasn't it. After kind of narrowing down a few things, I had applied to Massachusetts. Actually, I applied to be the director of health equity for Massachusetts, and I applied for Virginia. And I applied for Virginia. Then I went out of the country. Charlottesville happened while I was out of the country. I was watching this coverage from actually Africa. And I was like, yeah, I'm not going to Virginia. Like, y'all declaring states of emergency and stuff, and tiki torches and white supremacists. Like, I can't. So I was like, I don't think I'm going to go to Virginia. Lo and behold, I'm in Virginia. That's literally where I am now. I live in Richmond, Virginia. I've been here for 4 years now. And ultimately, Virginia won out. I had to sit back and really challenge myself as to like why was I potentially against coming to Virginia? One, it's the cradle of the Confederacy. Like, let's just be honest, right? The Virginia has had a significant leadership role, if you will, in codifying race and racism in this country. Virginia had the highest number of millionaires per capita at the height of slavery. So there's a lot of deep-seated history, both past and present here, as it pertains to racism, as it pertains to how that has an influence on health outcomes and health equity. But I really had to start thinking, one, Virginia has both an urban and rural population. And that was very appealing to me because I really wanted to work in a space where I could have the opportunity to learn about both of those areas, right? Like, a lot of times people think about health equity and they're only thinking about it as an urban problem. It is a rural challenge as well. And quite frankly, the challenges in urban and rural areas mirror each other very closely, right? We're just talking about slightly different demographics and slightly different landscapes, but the challenges are very much the same. So I was looking for an opportunity to really assert my leadership across both of those very different kind of atmospheres. The second is that I was thinking about, how many other opportunities would there be for a young Black woman to be in a position like this? I happened to end up being the youngest Black woman in this position in Virginia state history. It was also the first and only, to my knowledge, with a PhD to be in this position. So that was really a great opportunity, and very, it was just great. It was a great opportunity, and really spoke to me as well. And the third, I was thinking about, what better way to honor my ancestors than to be in a position like this in a state with this history. And that is what ultimately led me to say yes to this position, which was, it was a very challenging position. I learned so much about leadership from that position, but I'm really grateful that I said yes to it. And apparently I still like Virginia because I'm here.
Yeah, that's awesome. I'm glad that you I guess you reflected and realized that you could make an impact in this place regardless of the history that it had. And as we were talking earlier, like I think the same thing with the pharmaceuticals. It's like you need to be in these spaces to have this type of changes. So it's not going to happen. We can just point fingers and it's going to happen. We need people to actually take up space in these places and actually fight for the change from inside out. So we appreciate you doing that. So what were the major things that you did as a director of at the Office of Health Equity?
Yeah. I think the biggest things that we did were really raise the profile of the office and really help educate across the state, educate people across the state on what health equity is. We had the opportunity to host the state's first health equity conference and think tank, where we brought together stakeholders from across the state and some even from around the country to really think about the role of all of us and really trying to work towards health equity. So it was 2 days, and the first day was really about kind of introducing the problem and talking about how much of a challenge health equity is, and all the social determinants of health, everything that goes into health, to creating health. And then the second day was about thinking about solutions, like how do we work together to create solutions from the community level up, and then thinking about taking some of those suggestions and actually figuring out how to operationalize them. We also had the opportunity to host the state's first ever LGBTQ plus health equity symposium in honor of Pride Month, in honor of the LGBTQ plus community, who was very often not appropriately included in our health equity discussions and our talks about health. We really have to be much more intersectional in that regard. And so we're really excited to be able to spearhead that. And several other initiatives. We had a grantees program in the State Office of Rural Health, which was also part of the Office of Health Equity. We increased funding for placement of health providers in health provider shortage areas, which tend to be rural areas as well. So just a few. Oh, and I should mention one other really big thing we did. Helped to kick off the Henrietta Lacks Commission, which was something that was created by the Virginia legislature to uplift the life and legacy and memory of Henrietta Lacks, and also to create that team. The commission is tasked with creating a life sciences and biomedical research center in the southern part of Virginia. So we had the chance to kick that off and to host Henrietta Lacks Legacy Week in conjunction with that as well. So.
Okay, yeah, that's awesome. I'm glad you didn't not mention that, because I think that's something a lot of people like just forget or just don't know, and it's a history that I think we should all know and we should all reflect on and see how we can do better moving forward. So we appreciate you once again.
Yeah, thank you. And people don't really know, Henrietta Lacks was actually from Clover, Virginia. So she's from the Virginia area, and that's why we honored her in that way. So.
And then after this position, you moved on to become the vice president at the head of healthcare industry at Time's Up. So first of all, it would be helpful if you say what Time's Up is, and then tell me how you get into this role.
Yeah, Time's Up is an organization that works to try to advocate for safety in the workplace for women. I had the opportunity to help kind of launch Time's Up Healthcare, which is specifically focused on ensuring equity in the workplace for women working in healthcare. And we think about the connection that has to health equity, right? That health equity is not just about kind of this outward facing perspective that I feel like we often think about, but it also encompasses our healthcare workers as well. Something that I think has become so very clear amid COVID is that, like, if our healthcare workers aren't healthy, like they can't take care of like the most sick people, right? So if we're not also ensuring equity for our healthcare workers, who are overwhelmingly women, by the way, then how can we ensure that we're really pushing for health equity for everybody?
Okay. And then how do you get into this role, or why did you decide to switch into this role?
Yeah, I decided to switch into this role because I think that I enjoyed my time in government. I was looking for a way to make an impact on a different level. I also think that, again, I think we consider health equity from a very one-sided approach. That is, we're always kind of looking outward about it and looking at it outwardly, which I do think is really important. I think community focus is really important, but I also think, that perspective on health equity has to be 360. So it has to be not only that we're looking out, but we're looking all the way around to make sure that we're including everyone in our definition of wellness, that population health includes our healthcare workers too, especially women of color, and those who tend to be most marginalized in the workplace.
And then did you work specifically around everything that you mentioned there, or just generally around everything that you just said?
Generally around everything. Yeah. And COVID hit, very early into my time, honestly, like two months into my time there. So we spent a lot of time focused on COVID, focused on, uplifting the fact that women are front and center in this, and the frontline healthcare workers are overwhelmingly women. It's like women make up like 70% of the healthcare workforce. So we're thinking about nurses and, home health workers and all of these other techs in housekeeping, environmental services in hospitals. All of these positions are overwhelmingly held by women and overwhelmingly held by women of color too. So continuing to raise the flag and acknowledge their efforts and advocate for their safety as well.
Okay. And I don't know if I got this wrong or right. I have here that you were 2020 Fortune 40 under 40. Was this during this time while you were Time's Up that you got nominated?
It was, yeah, that's correct. That is correct.
Tell me a little bit about that.
Yeah, it was a surprise to me, a very pleasant one. That, to be honored for not just the work I did at Time's Up, but really all the work that led up to being at Time's Up was truly, I was truly shook by it, quite frankly. I'll say, COVID hit very early during my time at Time's Up, and then I had the opportunity to really speak out as one of the first voices to draw the parallel between COVID-19, racism, and the murder of George Floyd. So right after George Floyd was murdered, I'd say the weekend after that, once the videotape started to circulate and, there was national and international outrage, an editor from a publication reached out and asked if I would write an op-ed, which I said, sure, not knowing what I was saying yes to. I was like, okay, when do you need it? And he was basically like, yesterday. So I was like, oh, okay, let me write this. So I really wanted to write it sooner than I could. I had a lot of time, a lot of trouble concentrating because this was protests were happening everywhere. It was mass chaos, and finally buckled down and I wrote this op-ed in a morning, 2 hours or something. It was about the intersections of COVID, racism, and George Floyd, and it went viral. It was one of the first op-eds out there, and it totally blew up. It led to this I had this media tour, BBC and PBS NewsHour, and I was like, what is happening here? And it really caught the eye of a lot of people. And so that was part of what led to my honor, this honor of being bestowed as 40 under 40 for Fortune magazine 2020. And it was a really interesting year for them to do that because they created several different lists. I understand historically they only had one list, but last year they broke it into different categories. So they had government politics and digital, tech and digital and media. And then they had a healthcare list. And so I made the healthcare list along with our fellow colleague, Andre Blackman of Onboard Health. So among really great company on that list. And it is such a tremendous honor. I'm so very blessed, grateful.
Yeah, that's awesome. And congratulations for getting that honor. And that's awesome that you wrote this op-ed in 2 hours and it blew up and went viral and you got so many speaking opportunities and a lot of other things coming from it as well.
Yeah, I was not expecting that. So I'm trying to write more because I actually realized that's something I'd like to do. And all this academic writing has been because I had to, but this was something I wanted to do. And now I'm trying to challenge myself to write more. So maybe more to come. I don't know if it's going to go viral, but we'll see.
Well, we'll definitely tune in and check out all the writings that you do. So we look forward to that as well.
Thank you.
And then earlier you spoke a little bit about you wanting to start the Equitist from the work that you did in the consulting before. So you're the president and CEO of the Equitist. So first of all, what is the Equitist, and then how did you get this started? What was the thought process more in depth?
The Equitist is my company, is a boutique consulting firm that focuses really on operationalizing health equity. So moving systems, leaders, and organizations beyond commitments to health equity in words and in theory into actual action. I've known for a little while that I wanted to consult at some point in my career. I did not think it would be right now, but at some point in my career, I said I want to work for myself and I want to call the shots. But when COVID hit, I was not in a position of direct service like I had been when I was working in the government. So I felt really like kind of out of place for a little while. I really felt like I actually have FOMO. I was like, how could this be possible? This is the moment I trained for, and I'm not in a position of power and authority per se in like government and state government, which I literally just left to really help in this time. So I don't, I felt really kind of lost for a little bit. And then I said, wait a minute, get it together, sis. Like, no, I don't have to sit here on the sidelines. Like, first of all, people are going to start declaring a state of emergency. I know that this is going to have a disproportionate impact on communities of color. I also know how government works because I just used to work in government. And I know for a fact, there are a lot of people who will talk about health equity who have no idea how to put it into practice. So I said, you know what? I'm going to start my company now. So my boyfriend actually helped me fill out all the paperwork. He is a serial entrepreneur himself and helped me fill out all the paperwork. I picked out a name and I went with it. And 2 weeks after I filed the paperwork, I got a call from a cabinet member of the governor's office saying, Dr. Powell, we need your help with COVID. We need your help from a health equity perspective. And I said, okay, would you like to be my first contract? You could be my first client. They were like, yes, sure, whatever. So I have been working with the Department of Emergency Management and parts of state government here in Virginia for the past year and a half, quite frankly, on COVID, on ensuring a health equity lens being brought to everything that we're doing. And I've started to branch out to other clients as well. So we've been embedded in a couple of organizations. We have a couple of grant opportunities coming up to work on. And I mean, at first I thought the Equitist was just going to be like, again, my side hustle, a little something I could do on the side. It has totally blown up much more than that. So people are contacting me all the time looking for ways to work together. Eventually, this will be what I do full time, not just yet. I think there's some other things I want to accomplish where I am first, but yeah, we're about action. We're about moving from just talk, a lot of lip service right now, a lot of commitments, a lot of task forces. Let's stop admiring the issue and actually move to action, and that is what the Equitist is about.
And I like that a lot because I do agree with you. A lot of people do talk, but they don't back it up, and I'm glad that you're doing this work. So tell me. So it sounds like you have this for a little bit over a year right now, I'm guessing.
Yeah,
Yes.
it's almost a year and a half, almost. Yeah. So we turned 1 in March.
Okay.
Mm-hmm.
Again, what has been the progression of it on the business side? Because you said that your boyfriend helped you fill out the papers. Was it just you who started and did all the work by yourself? And is that still the same to this day?
So I have a couple of partners. I have a managing director. So Aaron Dowell is my managing director, someone I have met in the pandemic who I did not know at all before this. I actually made, I thought it was a very subtle update on LinkedIn. It was like not the kind that was like broadcast to everybody, like I have a new job. It's just very subtle that I started, have the Equitist and that I'm working there, I'm president and CEO. And Aaron graduated from Xavier a year after I did, but we have, lots of contacts in common, and reached out through the grapevine to get to me and was like, I want to help you build the Equitist. And I was like, that's funny because I'm not building anything. Like, it's just my side hustle thing. So, and I was like, okay, that's cute. Like, we can talk maybe, but I didn't really, I was like, that's really nice, but I'm not really building a company. Someone must have reached out or something happened. And I was like, okay, just kidding. I need some help. So, so I reached back out to her, like, do you still want to help? And she was like, yes. So she's been working with me. She has helped me. We have built this thing together. We're, envisioning everything it can become. I have one other colleague who is also supporting. We held a retreat at the end of last year. And so I have a community, really almost a quasi board of directors, if you will, a community of people who are supportive and who are helping me create this in real time, quite frankly. So I am still doing a lot of the legwork, the administrative work, still helping with facilitation and creation of resources and all of that. But I do have a couple of other people assisting as well. And soon I'm probably going to have to hire some people. So that's definitely coming in the very near future. And who knows how big this becomes? We could be the next Deloitte. I don't know. Who knows?
Yeah, we need that. We need an equity focused Deloitte.
Yes, we do. Yeah.
Absolutely. And then tell me a little bit about, you said that people have been reaching out to you to be clients. Do you do any active marketing on your side to get clients, or has the organic reach just been good enough for you for the moment?
It has been word of mouth, quite frankly. Like, I have not really tried hard to advertise services. I've posted that we have the Equitist. We have a website which people are free to visit, theequitist.co. But I haven't really hit the ground hard with advertisement. So this has really shocked me, quite frankly. And also just reminded me how significant networking really is and how significant networks are, that people have reached out to me, for opportunities. People have reached out to work with us, and it has really been word of mouth. It's really been through personal relationships, networks, and colleagues so far. So that means, I guess, if we really start advertising our services, I might have to have a different job soon. So I don't know how soon that's coming, but it's on the horizon eventually,
Yeah, definitely. And I look forward to seeing that growth and everything that does come with it. And how do you go about balancing? Because I'm going to get to your next role that you're currently in right now. How do you get to balancing both the Equitist and this and everything else that you're doing? Because I see you've been on a lot of other features lately.
Yeah, I don't balance. I don't know. I honestly, I can't answer it because I am a multitasker. I will say I have been used to doing a lot for a long time. So what may sound overwhelming to a lot of people really is exciting to me. And like I said, this is the golden hour for people who really are champions for racial equity and for health equity. This is the window of time that I think people have been waiting for. I think about scholars and trailblazers like Kamara Jones, and so many others who have Reed Tuckson and so many others who have blazed this trail. And the fact that they may have never, Gail Christopher is another one, they may have never thought that a window like this would come. And here I am at this point in my career, and this window is here. None of us know how long this window will last, though some of us could probably hypothesize that because of the short conscience in America, that this period is going to pass by quickly. And so this is the time to do any and everything that I possibly can do within reason, because I'm not going to burn myself out, but to do as much as I can, to make as much impact as I can, to be as present as I can at as many decision-making tables as I can, to make as much disruption as I can in this period of time. And that's precisely what I'm trying to do. So I don't know that there's a perfect balance. I think that I'm working really hard right now, but I also know that it's not going to be forever. And maybe that is the balance that I'm working sometimes what feels like 60 hours in a week or something. It's very, decision heavy. It's very intellectually intense, but it's also what I was made for. It's hard to explain. Like, it's what I feel like I was put here to do. And so while it is tiring, I'm not tired. And so I can keep going. Now, within reason though, I do rest. My sleep matters a lot to me. So people who know me know I will shut it down. I will go to sleep on you. But then I'm up bright early the next morning and I'm ready to go. So I don't know. I think I also balance it with friends who keep me going, my squad, my people, my family who really keeps me grounded, and really, really embracing self-care, that I will take the time. I do get a massage every other week, right? Like, I'm going to get my nails done. I'm going to do the things that help me relax and recharge so that I can, continue this work on behalf of our people.
Yeah, and I absolutely agree that sometimes in life, no balance is the balance that you have to do, especially when you see that there is this opportunity, and it is like the one time in life that they've been created so much opportunity and momentum that you can just keep on blazing through. So I definitely understand you, and I support you. Just don't burn out yourself, because we need you in the long run.
Yes, absolutely. And, there are no bonus points for burning out. So, and I'm so grateful and blessed. And I think we're also privileged to learn that so early in our careers. And I think about my mom and my aunts and my grandmother and all of my ancestors who didn't have the luxury of self-care, who didn't have the narrative or even the words to describe burnout or being tired or needing to rest. And we didn't have that cultural capital to be able to do that. And so it is a privilege and an honor, as well as an act of resistance, to rest. And I absolutely do exercise that.
Yeah, as you should, And then coming full circle to all the naysayers from before, you are now Vice President of U.S. Health Equity and Community Wellness at Takeda Pharmaceuticals. So tell me, how did you get this position?
So, it's interesting. I saw this position, somebody shared this position with me long before I actually ended up pursuing it. And at first I was like, oh, this is post George Floyd. Everybody's looking for somebody to be the spokesperson for equity. There were a lot of roles that were titled maybe health equity, but really not health equity focused, more like focus in HR, or, people just it's still happening, don't really know where they're wanting this skill to go. So I was like, I don't know if y'all are really ready. And then I was like, not only do I not know if your position is right, I don't know if you're ready for me in particular, that, I'm looking for a position where I can make an impact, where I am not a token. I'm not here to be your black face in a white space, right? I'm here for actual change. So I ignored it at first. Then a colleague really came to me and said, like, no, this is you. This is your job. Like, this is it. So I was like, okay, I guess I'll pursue it a little bit. So I still, though, was very skeptical. I was like, pharma, I don't know. I'm not really sure, what y'all are all about. I heard some things from other people. So I came in very skeptical and really had a lot of questions. How serious are you about this position? What type of resources are you going to put behind this? I'm talking money, people. What kind of change do you want to see? Is this an academic exercise for you? And they were very consistent from the top all the way down about their desire to really invest in health equity. That this is a space they played in more globally, but maybe not domestically. And I was like, well, I've done some work in government, I've been in nonprofit, I've worked in federal and state government. Like, I do think from a resource perspective, out of all of those areas, pharma is one that could be a very powerful place to operationalize this vision, this desire to really move closer towards health equity. And so I started thinking about it more from that perspective. And then I was really intrigued, and I was like, why? I have always been interested in, diversifying clinical trials, and yet a lot of pharma is hanging their hat on that. Is like, this is health equity. No, that is a piece of health equity, right? But I have the intrinsic knowledge of public health and understanding the full definition of health equity, the full definition of the social determinants of health, a lens and training on population health. And so I could really tackle this job in a different way. And the excitement around that is really what drew me to the position. So I've been there for all of 8 months, still learning so much about the industry, learning about the company, but I'm very much enjoying it. I'm actually pleasantly surprised that I'm enjoying it. And, I think pharma gets a bad rap. I think the pharma has a reputation of being greedy and people are mean and cutthroat, and that has not been my experience at all. The company I've been in, Takeda, is just very warm and inviting. People are genuinely curious and excited about health equity, and it's just been a really great experience so far. I have to say, it's been really, really great.
I'm glad to hear that. And I can only imagine the amount that you're learning 8 months in. There's probably, because it's such a complex industry and such nuanced things to learn. So I hope that you're able to learn and really make an impact. What are some of the biggest things that you do in your role? I'm guessing probably the first 90 days was just learning about the organization, the industry, and everything like that. But yeah, you can speak to.
Yeah. Learning for sure. I'm learning every day, learning new acronyms, learning new functions of teams and new systems. And I'm also thinking about ways that health equity can be woven into all those things that I'm learning about the industry. But I think the biggest thing I feel like I do day in and day out, honestly, is help give people a grounded definition and understanding of what health equity is. And especially the fact that health equity is not the same as diversity, equity, and inclusion. So in a lot of healthcare spaces right now, you have these two really big concepts that both have the word equity in them, like floating around. So people are using them interchangeably. So sometimes we're talking about interventions that are really health equity centric, and people are saying DEI, our DEI initiative in a certain therapeutic area. And I'm like, that's actually a health equity initiative. So really helping to ground people in this is what diversity, equity, inclusion is. It's more about how we work together internally with an appreciation and a lens for cultural humility, recognizing microaggressions, right? Thinking about our practices and our policies, how we retain, recruit employees, build a pipeline, all of those things. Whereas health equity is more focused on how we take those values that we have internally and how we manifest them externally, working with our partners, working with communities, working with patients, thinking about how we improve the lives of our patients beyond just the medications we create for them, and thinking about the communities they come from as well.
Okay, and I look forward to seeing what you do 8 months from now, and however many more years you plan to stay at Takeda Pharmaceuticals.
Yeah, thank you. Thank you.
You're most welcome. And then before we move on to the Furious Five, the last section of the show, I would like to ask you, where would you like to see yourself in the future?
Whoa, I don't know yet. Honestly, I'm still trying to figure out what I want to be when I grow up. I think all I can say is that I want to be in a leadership position, still constantly advocating for health equity, constantly advocating for racial equity, and beyond advocating, making moves and actualizing health equity. That's the most I can say. I can't say if there's a company or a position in particular. I just know that this is what I was born to do. This is my purpose. I'm so blessed and so grateful to have confirmation on many levels that this is what I'm here to do, and I will do it wherever I need to.
Yeah, and I like that answer, because I think that as life changes, as experiences come and go, we change what we want to do, and I think that's absolutely fair. But you know that you're focused on health equity in whatever way that makes impact at that point in time in your life. So yeah. And then moving on to the Furious Five, 5 questions I ask all guests. Number
Okay.
one, what advice would you give to a student trying to pursue a career in public health?
So advice for a student trying to pursue a career in public health. One, make sure you're learning about health equity. If you are not in a program that, or not pursuing a program that has a component of health equity and community health, you are not learning public health. So ensure that you are having that experience. Ensure that you're also challenging your ideas of cultural norms, of make sure you're challenging your own biased thoughts and what you think to be intrinsically the truth. Surround yourself with opportunities to challenge that. And third is, learn your epi and your biostats inside and out, but also be open to the fact that some of the things that we're learning are still very steeped in systems of white supremacy. And so you as students who are new to these curricula, new to this information, you are in the best position to question things, to be curious, and to push on why we say some things are just the way that they are when they don't always have to be. So recognize, you have a stake in leadership, and you have a stake in helping to shape the curriculum and the future of what we teach public health students, even while you are a public health student yourself.
Absolutely. I love that. That's very powerful advice. Thank you for that. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
What advice would I give them? So, I would just say be curious, stay open to opportunities, be curious, follow what interests you. A lot of the things that I pursued were very far off the beaten path. I said that before. Like, I did stuff that other people didn't do. And sometimes people didn't understand, and they still don't understand. Why do you want to pursue this fellowship? Like, you don't need anything else in your resume. You don't have to pad. I actually had an academic mentor tell me, you don't have to pad your resume. I'm not padding anything. I'm doing what's interesting to me. And what has led me to the positions I've had is just simply been, I've been interested. But two, I've also been prepared. Be prepared, right? Pursue your education, pursue the training that you need, pursue additional ancillary activities and fellowships and experiences that will give you additional perspective, and be prepared. Also be curious and be open to where positions will lead you. I have not always had, this, I guess, prestigious resume, right? I've worked in places I'm like, why am I working here? I've worked in Bath and Body Works, the whole limited brands, Target, Victoria's Secret. I've worked in grocery stores. Like, I have truly hustled to get to where I am. So don't feel like just because you can't figure out where this is going to fit in your story that it's not going to. Follow what interests you, and you will end up right where you're supposed to be.
Absolutely great advice once again. And number three, what's something you're working on improving in your life right now?
Oh my gosh, great question. I'm working on a couple of things. One, I'm working on writing more. So I actually have a personal branding coach. Shout out to Amanda Miller Littlejohn, who is my personal branding coach. And I'm working on writing more. So I'm working on actually taking the things that I think about, turning them into pitches and trying to write op-eds more. I'm also working on like wellness, all around wellness more. So I've been doing a green smoothie challenge for myself for the past 3 weeks. I actually have workout partners, so we work with a personal trainer. So we've been like have a text channel where we like send pictures of our smoothies every day. It's just a lot. Like, we really need accountability. So always continuously working on wellness. No, I think that's it for now. Yeah, personal improvement wise, that's probably it for now. Maybe meditation, I would say. I'm adding like breathing and meditation and trying to work more on that.
Okay, that's good. All great things that we all can add and continue to build on in our lives.
Yes.
Number four, professionally, do you recommend anything?
Professionally, do I recommend anything for
anyone? People answer it different ways. People give advice. People talk about like books or podcasts or different things like that. groups, anything like that?
I'll say I'm not a huge podcast person, even though I really wish I was, because it sounds like there's tons of really good ones out there. I think professionally for me, servant leadership, I think that's the name of the book. Servant leadership was like really good, really powerful for me. Um, you know, I'm a Christian, I believe in God, I love the Lord. And so when I think about my approach to leadership, it truly is in service of others, which is a part of my faith and a part of my family and just the way that I was raised. So that's been a really powerful book for me. I think there's just there's tons of others out there too. But I think for me, just really seeing my leadership as an extension of service unto others, and health equity to me is a modern gospel of service unto others as well. And that's really helped me.
Okay, good advice there as well. And then last but not least, where can people connect with you?
Oh, yes. Please connect with me on LinkedIn. Please connect with me on Twitter at Dr. Dr. Lauren P. You could connect with me on Instagram. I'm trying to be more present on Instagram, I guess. That's at Dr. Lauren P. Dr. Laurenp. And then the Equitist, you can also follow the Equitist on LinkedIn. You can follow us on Twitter as well, all at the Equitist. And yeah, I think that's it. And you can visit our website too. And our website is theequitist, all one word, .co. And leave us your email address if you want to be a part of our like email list serve and things like that.
Awesome. And I'll definitely be sure to link all of those in the show notes for anyone trying to check those out. But thank you so much, Dr. Lauren Powell, for coming on the show and sharing your insights and your story and all this great information.
Amari, thank you so much for having me. It's truly a pleasure. Thank you.
It definitely was my pleasure. And some housekeeping items. Thank you everyone for watching or listening to this podcast. I greatly appreciate it. Make sure that you subscribe, that you like, that you leave a review and share it with a friend. And if you want to support, you can go to buymeacoffee.com/the PH Millennial. And see you all next week.